What's going on? How is everybody doing today? Welcome to the Risen Fallen podcast. I am your host, Mark Hendrickson. And if you're brand new to this show, then what you can expect is open and authentic conversations about things like mental health, self-development, and how to get your life moving in the right direction. If you're not feeling good about where you are right now, at least having the confidence knowing that you are getting closer to the person that you'd like to be, the life that you'd like to have. And if you're not new to this show, then thank you very much for coming back, supporting the cause, supporting the journey, supporting the idea, and the notion of making yourself 1% better every single day, and along the way, lifting other people up as well. And so, happy Monday. Hope you guys are doing well. It is Friday morning as I record this. I'm about to head out. The sun's just coming up, and it's chilly again here in Vancouver. It just got cold again, but yeah, I'm about to head out to work. I'm just waiting for some paint to dry on some baseboards that I pre-painted. That's why I got some paint on my fingers now. But yeah, I'm just chilling out here. And I was kind of re-listening to the episode that just dropped. So yesterday for me right now, but this will be like a week or so ago. That episode that I dropped with ChatGPT. And in hindsight, I thought it was funny to watch because it's so much more obvious how little I can pay attention to conversations and thoughts with my own thoughts while I'm trying to do something. You know, I'm very distractible, and so for me to obviously use ChatGPT while I was trying to record stuff, kind of funny. I feel like it's probably better moving forward. If I just kind of maybe do those things beforehand, and then just, the live reaction's tough for me. I don't know, just because I always usually have to try and think about things a little bit longer before I can actually form an opinion, but that's exactly what we're doing today. So as I rewatched the episode that I dropped, talking with ChatGPT, giving me advice, I'll throw the video link in the description or whatever. I don't know how to, as I was watching that, what I noticed was something that I found a little bit interesting. I found it to be interesting because it's something that I've discussed before on this podcast, and it's something even in the order of the answer, and I don't know if this was done in any particular order or anything like that, but I remember I have the screenshot of it here, so it's a lot easier for me to just read it now, but when I was asking ChatGPT about how to improve my mental health, how to get in a better mindset, the first answer was regular exercise. The second answer was healthy diet. The third answer was sleep. Fourth answer was meditation and mindfulness. The fifth answer was social connections. And then the sixth answer was professional help. And now, I don't think this is in any particular order or anything like that, because the following like 3 or 4, I think should be maybe rearranged in terms of orders as well. Those being hobbies and interests, engaging in activities that you enjoy, like that kind of stuff, limiting drugs and alcohol, screen time balance, it's funny how they have to categorize screen time in and of itself. Like it's like limit alcohol, drugs, and screen time, which is like the fact that we, even though it's self-evident, have to discuss it in the same conversation as like, yeah, we know that alcohol kills people. We know that drugs kill people. We see places like the downtown east side. We see things like that. And yet screen time is like literally like in the same conversation as that. And I think that the degree of separation is just like, oh, I live in a home and my life's not completely ruined, just like my emotional and mental health are. And so like it's kind of like, yeah, it's this weird thing how we look at drug and alcohol addiction. And I'm sure this conversation's been had about many other behavioral addictions, like sex addiction or whatever else. But it's interesting how we take a look at alcohol and drugs and those types of addictions, and then we have this like clear separation of like, oh, I'm not like that, while we spend like 8+ hours looking at screens a day. Like, it's like, obviously there's a little bit of an addiction behind that. But and then the last one is stress management. And so I thought that it would be interesting, and it kind of, I took a glance at it, and then I thought about what I was gonna kind of what I thought about what I thought about that, and then I looked at it again now, and I'm like, yeah, I actually do like those 10 things alone. If you were to do those things, you'd be pretty hard pressed to find somebody that was like achieving these things and then still not feeling good. Like, there would have to be something pretty seriously wrong, and like they might, it might be an anomaly, it might not be an anomaly. Maybe I'm completely out to lunch and like I don't know what I'm talking about here. But I feel like if you were to do these 10 things, which I find reinforcing, because this is the exact same, basically 10 things that I've been talking about for the last couple of years. Regular exercise, healthy diet, sleep, mindfulness, meditation, social connections, hobbies, interests, limiting alcohol and drugs, screen time, stress, like those types of things. These are the types of things that I've been talking about. So to hear this, even though it's coming from like a AI thing that I find creepy, and I find kind of, it is pulling from all the sources of the internet. And so, I don't know, maybe that's because I've learned so much through the internet, and there's some sort of algorithm going on that led ChatGPT and I to the same conclusions. Or it's because I've been trying to practice these things and I've seen some positive results. And so that's why I kind of advocate for them. Now, it's interesting here because ChatGPT didn't say anything when I asked it about, when I asked it about how to improve my mental health. ChatGPT didn't say a single thing about, and this is something that I find interesting, because a lot of people, when ChatGPT first came out, they were saying that it had all these different like inherent biases, like it was programmed algorithmically to have these like certain types of biases. And I've done these little experiments, and I'm sure you guys can look them up, where you ask ChatGPT to say certain positive things about certain people in present time or in history, and it is not willing to do it. And then there's other times where you can ask it to, I don't know, write a poem or a joke, or say something positive about a different person that, maybe the legacy news media and that type of stuff that they would be. What I'm trying to say is there's inherent political bias, supposedly. And even though I do find ChatGPT and this type of technology creepy, I didn't see that type of weird bias here. And the reason I say that is actually, again, a topic that I cover quite a bit. But, like the medical industrial complex of like trying to push all of these antidepressants, SSRIs, anti-anxiety medication, mood stabilizers, and quite frankly, essentially methamphetamine and cousin drugs to that, to kids that are, being overdiagnosed with ADHD and etc. Obviously, I'm not a huge fan of of that side of like the mental health realm. And I'm not trying to shame anybody that's on medication or anything like that. I'm just trying to say, like, I'm not a big fan of that aspect of it. Have I done these types of medications before? Yeah, I've been medicated for these types of things in the past with ADHD medication, generalized anxiety disorders, severe depression, those types of things. I've gone down that road. I've experimented with that with my doctor, but I noticed that these 10 things, even when suggesting professional help, it talks about therapy and counseling. It doesn't like once say go to your doctor, go to this person, go to that person, because I think that a lot of the time, even though we talk about mental health and mental illness as health and illness, it is something that is a completely separate entity, sometimes from, well, no, I shouldn't say that. I was going to say that it's a different entity than your regular health, but it's not, because they are intertwined. But what I will say is that the current medical system is incentivized, heavily, financially incentivized, to treat the symptoms of illness rather than to understand the cause and, nip it in the bud and uproot it. Where it's kind of like sweeping it under the rug until the rug has a pile of dirt under it so thick that the rug's no longer sitting on the floor. It's like fucking stacked halfway to the ceiling. And that's pretty much where our medical system's at right now. But I do find it interesting that though people claim that there's like this inherent bias in ChatGPT and AI and everything like that, and maybe there is, maybe if I went down this road, maybe I started to ask it and prompt it to talk about these things, maybe perhaps it would. But I just noticed that, and you guys can try these experiments yourself and let me know what you think. But I just noticed that, like, when I scrolled through it, and I'll blow the screenshot up, and it'll give you the 10 things, the first 10 things, or you can go watch that episode, like I said. But it was like the first 10 things, none of it included anything. In fact, the only mention of like quote unquote drugs, medication, whatever, because I'm sure that a lot of those drugs that it's talking about would be prescribed in a medical setting as well, in some, off in a different circumstance. And obviously, it's talking about people abusing drugs recreationally. But it does say the only thing that it mentions about drugs are avoid them. So that's it. Like, and I'm not, like I said, I'm not trying to shame anybody. I'm not trying to poo-poo you or to say, I'm not trying to be mean. But what I am saying, and the reason I think this is important to think about and focus on, to put it in context, is that it lists 10 other things. And I'm not trying to say that it wouldn't recommend going to see a doctor. I'm not trying to say that it wouldn't recommend going to see, some external medication or whatever. I'm not saying that it wouldn't suggest that, but I'm saying that there seems to be some sort of a reason why it would bring up these 10 things first, as if to imply, or as if to I guess imply, as if to imply that these 10 things, if you're not meeting these 10 criteria, then it's like, well, of course, there's no reason, there's no wonder why you're not feeling good. Of course, if you can't meet these 10 requirements, the exercise, nutrition, sleep, mindfulness, meditation, social connections, hobbies and interests that you like to do, avoiding things like alcohol, drugs, screen time, and stress, if you can't hit those 10 criteria, then of course you're not going to feel good. There's no reason to go to a doctor. There's no reason to start a medication. There's no reason to start these procedures if you're not even meeting the 10 things that are required, apparently, to the smartest robot AI fucking. And I'm some carpenter. I barely understand this, okay? So, but what I'm trying to say is, if you're not hitting these 10 criteria, then it's like, don't even think about going to the next step, like escalating this further. Like, you need to hit these things first, and then after that, you could be like, oh, I'm doing all of these things, and nothing else to really like make a huge detriment to my life, and I'm still not feeling good. Well, then it's time to go and look further. And perhaps before you even go to the medical system and the doctors and everything like that, like perhaps If you're dealing with something mental, a lot of the times that can be tied towards something spiritual. And I'm not going to tell you what religion to practice or what to follow or what you should feel good believing in. I know my way and I feel good about that. But you maybe perhaps just go down that road. Like try and find some sort of a spiritual connection to what you think is your creator. And you can ask me personally, like in an actual deep conversation about that, and I can make my suggestions for you. But I think as a blanket statement, I think the only appropriate thing to say is to find some sort of a connection with what you believe is your creator, whether that's the universe or you believe it's an entity like God, or whatever else you could believe. Maybe you believe that it's you, and that's says a lot about you. But anyways, I think that's a good place to wrap this up. I think I'm going to go check on if that baseboard is dried up yet. Pre-painted it so I can just go and throw it into this house and Bob's your uncle. But that's pretty much it. Hope you guys are doing well. I'm feeling pretty good. It's been a good morning. The sun is up now. It is a beautiful day. And I'm about to go out there and get it. So much love. I'll see you guys on Thursday. Appreciate you all. Hope you're doing good. Love you all. Bye.